Hi, I'm Dr. Sheridan. I'm one of the physicians here at the Dublin office of Timeless Skin Solutions. I just joined this practice after 15 years in dermatopathology, so skincare has been a passion of mine. In addition, I've been a client here for close to 10 years and just am so pleased to join this beautiful company where healthy skin is a goal for every client that walks through the doors. Today, I am going to be talking with you about signs of photoaging, particularly the sunspots that we all get as we age, and especially after the summer months. These are those pesky brown spots that kind of come up on your face, on the back of your hands, your neck, and for women, especially in the décolleté area. We have some great procedures and treatments here at Timeless to help you deal with those issues. Probably our best treatments include our lasers. So first I'm going to talk about Genesis and IPL. Our Genesis laser is a very nice warming laser that we actually wand over the top of your skin. It's a non-contact, gently warms the dermis, which is the layer underneath your skin, and helps to decrease redness, promotes collagen production, and helps with fine lines and wrinkles. And who couldn't use some help with all those things. The second one that we pair with Genesis quite frequently is IPL. That stands for Intense Pulse Light. You may have heard of it also as photofacial or broadband light. This is a laser that emits a wavelength that targets pigment or melanin in our skin, helps break it up, and lets the skin then exude it to the surface. The Genesis IPL is a quick treatment, about 30 minutes. You can come in, have it done, and there's zero downtime with it. You can walk out, there's no restrictions, you can put your makeup back on and go back to the office or back home or wherever you need to be, and no one can even know that you've had anything done. We do recommend 4 to 6 treatments to get optimal results, and those can be spaced about 3 to 4 weeks apart. Another wonderful option is the pearl laser. This is better for someone who wants a one-stop shop kind of treatment. This is a more intense laser. The results from one pearl, we would generally say equals the results of 4 to 6 IPL treatments. So you can see that depending on what you want, you can choose from either IPL or pearl. Pearl we usually, because it's intense, we have you put a little bit of a numbing cream on, and after the pearl, obviously, because it's a little more intense, there is a bit of a downtime. We usually say about 7 to 10 days social downtime. What I mean by that is you're completely functional, you're not having any kind of pain, but because it's a little more intense, you will have some peeling and some pigment come to the surface. So most people do like to, give themselves about 7 to 10 days downtime. Also, we do have some restrictions during that 7 to 10 days because your skin is very vulnerable. We have some restrictions on what you can and cannot put on your skin, and we give you full instructions as you leave. But that's another reason why, because there's a lot of makeup restrictions, people might want to just know they're just going to stay at home. I've had both treatments. They're wonderful. I've had great results, and it just kind of depends on what your life is like. Do you have an event in 2 months and you want to get it all done as soon as possible, and you have a few days off of duties, either at work or at home, then the pearl may be optional. But the IPL is also a wonderful, wonderful treatment, and like I said, I've done them both and had great results. Other treatments we offer here for pigment issues particularly would be microneedling and chemical peels. We pair those together. You could just get a chemical peel alone. Those also help with all the signs of photoaging, helps with collagen production, fine lines and wrinkles, but people are sort of surprised to know that they also are great pigment treatments, especially for our patients with melasma. At this point, it would almost be negligent to have you be paying and having such a commitment to your skin, financially, time-wise, that sort of thing, that why would you not want to do a great skincare maintenance program? And we strongly recommend that to all our patients. We have wonderful products. Particularly for pigment issues, I usually recommend 3 products. The first is a retinol, the second is a hydroquinone, and the third is Lytera. So the first is a retinol, and we all know Retin-A back, treating for acne. Well, a side effect they found was that it decreases fine lines and wrinkles, and actually is great for pigment as well. So the only downside to Retin-A is that it's not always tolerated well by the patient, meaning they get a little pink, they get a little irritated, some flaking, some dryness. Well, here at Timeless, we offer a wonderful product by Skin Medica, a retinol complex. I love this product because it actually encapsulates the retinol. And what does that mean to you? Well, that means it's much easier tolerated, and if it's tolerated better, you can use it hopefully every night. So that's why I love that product, and we have a different percentages, so we can start you at a low percentage and work up as your skin becomes used to it. The hydroquinone, we have wonderful Obagi products. I like, there's just a clear cream, there's a blender that you can actually mix with your retinol product and use it at night. It's a lovely product, I use all of those. This is also, Obagi has a serum that has hydroquinone. This is great for the morning because it also has vitamin C, which is an antioxidant. So it's a serum, it's real rich, great for morning, and that's what I use as well. Another product I love and I'm also a fan of is Lytera, another Skin Medica product. Works by a different pathway, but very easily tolerated, can use it morning and night. And those are my 3 products, especially for pigment issues with patients. They work from different pathways, so they complement each other, and I think it will give you great results and help you keep the maintenance of the skin from the wonderful skin results that we've given you from our treatments, period.
So we have a couple questions, Dr. Sheridan, about the pearl. Someone would like to know, how long do the results last after receiving the treatment?
The results can last a very long period of time, at least a year, I would say. All these procedures, I would suggest a maintenance, even IPL. Once you get the results, we typically suggest a maintenance program of number 1, your daily health care regimen, and also IPL may be done twice a year. A lot of people do it before the summer and after the summer just to kind of get ready for that. Unfortunately, the exposure to sun, which will make our aging worse, especially our pigmented lesions. And then once in the fall, after the summer is done, to kind of clean up whatever damage was done. But you can see results for years after the pearl. I have myself personally.
Okay, a follow-up question to that you had mentioned that you would use numbing cream when receiving the pearl treatment. Can you tell me, or tell the patients out there, what would they expect in terms of how it will feel during the treatment receiving it for the pearl?
Okay, so very tolerable. Since I've had it, I can give you my own personal experience. So the numbing cream we usually put on for an hour beforehand, and if you've never had numbing cream on, it feels exactly like when you go to the dentist. You just really have decreased sensation all over your entire face. So when it is time for the pearl, it'll feel like, it feels a little like IPL, sort of a hot snap of a rubber band, but very tolerated. I am by no means a brave client, and I have tolerated both procedures quite well. Also, we have this wonderful piece of equipment called the Zimmer. Sorry, kind of blanked there for a minute. A Zimmer air blower, and it's exactly what it sounds like. It blows ice cold air, and you can aim it at your face, and also makes these treatments very tolerable.
So you had mentioned downtime with the pearl. So what can you expect? The first few days are you stay in the house, or you can go out, or is it really kind of an individual thing?
It's really individual. I went to the movies, but a lot of people probably just hang around the house. Especially, it's a great time, especially in the winter if the weather is bad. People can redo their basements. You know, it's a great time to redo your closets. Most people do tend to like to hang around home, but like I said, I went to the movies. I know people who work here at Timeless will sometimes even come to work. You know, I mean, it just depends on whatever, you know, what your comfort level is, and everyone will have different degrees of pigment that come out, and different degrees of tolerance to going out in that condition. Absolutely safe, as long as, once again, what we worry about most is that we want you to keep your skin in its vulnerable condition. We don't want it to be exposed to anything by touching it or putting different creams, unless we have specifically suggested those treatments.
Okay, this question actually goes back to the Genesis IPL. Can you do them independently of one another, or should they always be paired, and what would be your recommendation?
So they can be done independently, especially maybe for a younger patient who has more acne issues. They may not need the IPL, they may not have pigment issues, but they can benefit from Genesis with the decreased redness. Genesis is also nice to fade acne scarring. So like a younger patient may choose to do Genesis instead of Genesis and IPL. And also a lot of people will just have the IPL. They have the pigment issues and they just want to, you know, they maybe have a time crunch and they would like to just do the laser that's mostly for pigment. But I suggest doing them together. It doesn't add that much time to your appointment time, and they complement each other very well.
So how do I know if I think I'm looking at my skin and I've got some sun damage and unwanted freckles or spots, maybe some uneven skin tone, how do I know what treatment is the best or most appropriate for me to get the results that I want?
Well, here at Timeless, I would say you should call and schedule a consultation, and our professionals are well trained and very knowledgeable, and we are not going to waste your time. We're going to help you decide the best route to getting the results you want. So it's really best to come in for a consultation and let us help you formulate a plan that will get you the best results.
Okay, let's see what other questions that we have. So with the IPL treatment, they're wondering how long it takes. I think you had mentioned a time with that. If I was going to come in for IPL, about 15 minutes? 15
minutes for IPL, probably closer to 30 if Genesis and IPL, but 15 minutes probably is about right.
And then for the products, which would you suggest to pair with which treatment again?
Actually,
all helpful?
I think they're all helpful. If you have pigment issues, all of these products are extremely helpful. And like I said, if you've made that commitment financially and time-wise, it just seems, you know, almost a waste of money in a way, just not to be doing daily management as well. Maintenance is not passive; it's an active process that you always have to be, you know, continuing to help your skin look its best.
So it sounds like this might be a great time if patients are interested to come in and make a consultation with summer ending and an opportunity to improve some of that damage that we have.
Absolutely, the fall is a perfect time because one of these lasers we tend, like IPL, we don't like to perform them on if you have a suntan or if you've used spray tan. So the fall is a great time to come in and clean up all the damage that was done. Unfortunately, even the most diligent of us will have some damage from the sun exposure of the summer. So the fall is a great time.
Okay, we got one last question before we wrap up. Dr. Sheridan, somebody would like to know, what is the best option if I have dry skin?
Dry skin, really all of these options are still wonderful. The Genesis I would definitely add a Genesis to your regimen, but IPL and Pearl, all the lasers, they help with dryness. They help rejuvenate your skin, even your skin tone and texture, and can help as well. And if you do have dry skin, the retinol, I would definitely recommend the Skin Medica retinol because it is encapsulated and will be a little, be a gentler option for you if you have dry skin. But all of these work well with dry skin, and all of the treatments that I've mentioned today are great for dry skin.
So our first step should be to call and book a consultation and then come in and see you.
Absolutely. Come
Okay.
see us.
Thank you so much, Dr. Sheridan, for helping us out, learning about lasers and what we could do with pigmentation and some damage.
Thank you.